So post-op imaging showing this, you can see the anterior pituitary. Now it looks more normal configuration, and then you can see the preoperative imaging next to it, and then that area is enhancing, and then you can see the surgical resection cavity of just posterior inferior to it. So here is a coronal view. You don't see any abnormal signal intensity there, and then here is the post-control study shows this homogeneously, again enhancing anterior pituitary. So, and this is axial imaging. The axial imaging nicely showing this superior right side of the imaging shows posterior pituitary is well maintained, and then anterior portion has a little line of hypointensity, but there's no big layer of hypointensity, which was seen in the previous preoperative MRI.
So for her post-operative course, on post-op day 1, she began to have a large increase in her urine output of about 1,700 milliliters over a 3-hour time, with a urine-specific gravity that was less than 1.004, with a urine sodium of 30. At that time, her serum sodium was 136. She was then thought to have DI and was given a dose of DDAVP sub-Q. She then had stable urine output until the afternoon of post-op day 2, when she had another increase about 1,500 milliliters over a 3-hour time course. Urine-specific gravity at that time was 1.004 with a serum sodium of 140, and she was given a second dose of DDAVP. She was then discharged home on post-op day 4. On post-op day 6, she was had a serum sodium that was actually low at 126. We saw her in clinic, and we advised her to restrict fluid intake and increase her salt intake. She was having some nocturia at this time and still increased thirst. She then had labs done on post-op day 10, which showed a normalization of her serum sodium to 143. And then on post-op day 13, her serum sodium was 139. And we saw her again in clinic, and she continued to report this nocturia anywhere from 1 to 5 times per night, and still this increased thirst from baseline. And at this point, the plan is to follow up in 6 weeks. And the question is whether she will develop permanent DI or return to normal at this point. This is just a graphical representation of her serum sodiums, and you can see that there has been a triphasic response in her serum sodium.